make sure Sarah's keeping up with me here. She's handling all the technology. We're recording now, so I will officially say good morning and welcome to Generate Health's 9th weekly webinar, Navigating COVID for Moms and Babies. My name is Kendra Kopanis, and I'm the Executive Director for Generate Health. And I'm feeling a little surreal today. This is the 9th week we've done this, and I hosted the first week, and since then our team has just been rocking and rolling every week, putting together a great webinar that's connecting all of our partners. As customary, I want to just start out saying that because of the number of attendees, we have muted all lines, and we do, though, encourage questions and information sharing. So use the Q&A function at the bottom of the screen to send us your questions. And then to share information and post resources, please share that in the chat box. So we'll capture all that information and send it out after the call. And as I've indicated, we are recording the webinar so that we can share it with those who are unable to attend today. Just quickly, background on Generate Health. We were founded 20 years ago as the region's Maternal and Child Health Coalition. And our mission today is to mobilize the region to advance racial equity in pregnancy outcomes, family well-being, and community health. 9 weeks ago, we started this weekly call as a way to convene, which is what we do, the maternal and child health community, to share information, to be connected, and to stay in touch with one another about how people who are pregnant and postpartum are at high risk for COVID-19, to coordinate resources that respond to the needs of service providers and community members, and identify collective action opportunities. I'd like to try a couple of quick polls this morning to know and learn a little bit more about who's attending today's webinar. So this information will give us and our panelists an idea who they're speaking with today. And if it goes well and if it goes smoothly, we may use this function again in future webinars. So the first poll question is, how many weekly webinars have you attended? Goodness, can you, hopefully everybody can see this. The results are coming in. And the other one is to tell us what describes your role. Are you a community leader, volunteer? Are you a health or social service provider, researcher, academic, advocate, elected official, public health, or other? See, we have a wide range cutting across many different roles in our community. And we've had many of our attendees have been with us week after week participating in this conversation. Looks like some results are still coming in. We'll just give that a quick second to keep looking at that and filling in the results. But thank you for participating in that poll. Thank you, Sarah. I think we can close that out. Wonderful. Really happy to be with everyone today for this important conversation. We have evolved each week to address different topics related to COVID-19. And today, our great panel here is to focus on a timely topic about reopening St. Louis, which is the language that we're hearing right now, reopening St. Louis. What are the implications it has on the most susceptible impacted communities? There's a lot of information, some misinformation coming at us every day, and it can be very confusing. The guidelines put in place by local and state governments are changing rapidly and vary depending on where you live. So we'd like to discuss the precautions our region is putting in place, what the community and data are saying about reopening, and of course, actions we can take to address potential impacts. Our panelists today include Ms. Kaya Shelton. She's a community leader and Flourish More co-chair. She's been canvassing with Prepare STL. Dr. Will Ross, Professor and Associate Dean for Diversity at Washington University School of Medicine and Chairman of the Joint Boards of Health and Hospitals for the City of St. Louis. And Ms. Rebecca Bennett, Founder and Principal of Emerging Wisdom and InPower Institute. Rebecca is helping to coordinate with the regional response team and supports the Prepare STL effort. So we have a great panel. We're going to start with Ms. Kaya Shelton. Dr. Ross will follow Kaya, and then Rebecca will follow her. And we'll take your questions and answer them following the presentations. Again, please enter your questions in the Q&A box, and then information to share in the chat box. So Kaya, good morning. Welcome, and please join us in sharing your perspective.
Yes. Hello, everyone. My name is Kaya Shelton. I am an active community leader. I'm going to share my implications with you all. And because I do ramble, I have wrote them down. So I will read what I've composed and synchronized to share with everyone. The implications for my concern for reopening St. Louis is the totalities that will take place due to the lack of awareness. I find myself having to redirect community members in stores by saying you're coming down the wrong way, or you should stand on that dot to practice social distancing. Without fail, the majority of the responses from my community members are, I did not know it, or I did not see it. Another fearful concern is the lack of miseducation through social mediums. I have been shown on my social media pages that Black people cannot catch COVID because they're melanated. It's a myth. I was approached by a man in a store when I had on gloves and a mask, and he told me that I was too woke. I had another gentleman in a different store tell me, you know, that mask cannot protect you. Why are you wearing it? And when I was going out to canvas, I had someone in my own team come to me and ask me, have you seen what's going on the media? They're saying that it's going to be 100 Black people they're going to send out to spread COVID. Another myth that I heard is it's a fear tactic of the elite to enforce martial law and depopulate the world. The last concern that I have about reopening, but it's the last of many, just for time's sake, is the lack of resources. Most local stores that I've been in that's in my community are mainly corner markets, and they don't have any inventory of PPE, which is personal protective equipment, excuse me, or essential cleaning supplies to reduce germs and the spread of viruses. I also canvassed and visited most of the local liquor stores, and they didn't have any signage up. I canvassed the food bank. None of the volunteers had on PPE. They had a line that was around the gate. Out of that line, probably 2 people had on a mask. I also went into a Walgreens that's in the local community and seen firsthand that the inventory that they get for cleaning supplies will not even service 1/3 of the community that it's in. The calls to action that I would like to see for pregnant moms and families are a targeted cultural fact sheet, food banks and resource hubs giving out PPE as well as essential household supplies to reduce the spread of germs, clear and explanatory education on how and why we should wear this and practice social distancing that can raise awareness, deplete miseducation, decrease the lack of resources to save our pregnant mothers and neediest families. I am complete. Thank you for your time.
Thank you so much, Kaya, for sharing your perspective, your experiences, what you're hearing, and your calls to action. Appreciate that. And we'll move next to Dr. Ross, and Sarah will share some slides.
Thank you first, Kendra, for inviting me. Thank you for Kaya for that really sobering and candid perspective on what's really going on and what people are hearing in our community. We have to wake up and we have to respond. Those voices are so important. I really appreciate you sharing. And thank you for the community out there that signed in to understand more about how COVID is impacting the African-American community, and particularly the African-American community of women and children. And so I want to just give you a few data slides just so we can get all up to speed on the current state, and then talk about our level of preparedness for opening up St. Louis and whether or not we can do this in a safe manner. So if you can advance the first slide, please. So the first slide I've shown before, and the media found this to be somewhat controversial, and I'm going to tell you why. This is a slide that comes from the Johns Hopkins database on COVID cases. These are COVID cases in the United States. It is non-controversial. The issue is that this is what we call a logarithmic curve, and it's showing that mid-February we start seeing an increase in cases, and we're now here we are in mid-May, and we're on this plateau. And if you look at this curve, it looks like a plateau. Some would state that in many cases it may be increasing. In fact, if you take New York City out of this case mix, you would see a still slight uptick in cases nationwide. Nonetheless, the curve, for the most part, let's call it stable. Let's call it a plateau. Because this is a log curve, it's going to, assuming that all goes well, it's going to take just as long to decay or to decline as it took to increase. So we're now in mid-May, and you can see when we started in early, 1st of March or so. So that really puts us into, well, do the math, right? We're looking at another 2.5 months before we see, this is all, if all goes well, before we see a significant decline in cases nationwide. That puts us, my goodness, into August, September. It can even go further as late as September. And that's barring any new increases of cases. So this is just kind of a reality check that nationwide we are far from being out of this pandemic. Next slide. Now I'm going to just show you some cases, COVID cases from the St. Louis County and the St. Louis City, so you can know where we are. And I regret that there's not a composite slide over this past week. I have some, but they're a week ago, so I just wanted to give more up-to-date cases. I took slides directly from the city and the county. And this slide really shows the growth of cases over time, and the cases are in the green circles, and you can clearly see that since late March that we were seeing this kind of steady increase in cases. Above that are numbers which actually represent the actual new cases, and the new cases are also growing, not growing as rapidly, but they are growing. And so we're not seeing a actual stabilization, but we're also not seeing a rapid rate of growth in the county. That's good news. Next slide. The city is a little different. So we're now looking at COVID-19 cases in the city. We're looking at time on the bottom axis, x-axis, the number of cases on the y-axis on the side, and the blue line represents actually cases. And you can see that this is much more of a significant increase per day. And you can also see that this line this graph is linear, that these are growing per day. So we're not quite seeing the stabilization that we saw in the county. But this is the curve is on a different scale. And so it appears to be more rapid than the county, but again, it's a different scale. For the most part, we're still seeing significant increases in cases. On the bottom of this axis, you can see red circles. And I don't know if you can pick up this, but it shows the red circles are the number of deaths. And as of yesterday, we actually have 108 deaths in St. Louis City. That is increasing slowly. That appears to have stabilized so far. As of today, I hope that remains the case. And so, essentially, the county cases are increasing. The city cases seem to be increasing more rapidly, but they're not. But the deaths appear to be flattening. It could change at any time. Next slide. This is the slide that I obtained from Alex Garza, who heads the region-wide COVID-19 pandemic task force. And this is the slide that should give us some relief that we may have gotten through the worst of the first wave. I said first wave because I can assure you there will be a second wave. But we're looking now at cases in the intensive care units at the area hospitals, BJC, SSM, and Mercy. And you can see that we peaked back in mid-April, and we seem to have at least stabilized over the past week. That is good news. We did not overwhelm the intensive care unit. We did not overwhelm our primary providers in the ER and in the hospitals, and that's a very, very good news for the region. We don't know where this slide is going to go. There are three scenarios. Scenario one is in the white curve, showing that if this is a best case scenario, this is what we want. We want to see us continue to decline. Scenario two, the gold hash line, you can see that we may see a slow decline in cases. Then the real scenario, of course, is in this blue line. It could go anywhere. We hope that trends downward. And again, this is actually good news for the region. Finally, that the number of ICU cases has stabilized, may be declining. Next slide. Now let's turn to something that hasn't gotten a lot of attention in the press, and that is the demographics of cases both in the city and the county. I'm going to focus, because of the time constraints, on the cases in St. Louis City. Now here you see an overview of cases stratified by race and age. On the bottom axis, you can see Blacks, African Americans. Then you can see an other case, and then on the right panel, you can see the cases of white individuals. And at the top, the bars represent different age groups, from 10 to 19 ages to 80 to 89. And what's apparent here is that there's a very different distribution of cases in the city among African Americans in the city compared to whites in the city. Very different. There's more of a kind of a Gaussian or kind of a general distribution of cases across all age groups in African Americans. There's less of this distribution of cases among the white population. But I want you to pay attention to something that has not gotten a lot of discussion. That is, within African Americans, we tend to see more cases in individuals who are 20 to 29, and more concerning, we see more cases in individuals who are under age 19, this dark blue. As you can see, there are fewer cases in the white individuals who are under age 29, and there were none in young individuals from 10 to 19. And so this is concerning, because there has been this belief that COVID tends to spare the youth, that it's more a disease or rather an infection among the elderly or individuals who are vulnerable because of their chronic diseases. And as a consequence, young people have assumed that, well, they're less susceptible, and as a consequence, they feel free to go out to the beach in Florida and just have themselves a great time. And we now know that that's not the case. The young people can contract the disease, and they can contract the disease and not be symptomatic. They can be asymptomatic, they can be carriers. As a consequence, they could spread the disease. So we just have to be cognizant of this. The bar under age 18 is what worries me the most. I think that this is the tip of the iceberg. We're not seeing a significant number of individuals in this age group because we're not necessarily doing the testing that we should, and it still is relatively early in this pandemic. I hope I'm wrong, but if things don't go right, we may see a rapid expansion of cases in this age group, age 10 to 19. They've been hyperexposed, and they may be less likely to get tested. And so that is of concern And that's why I think that the next stage for us as a region is to focus on this vulnerable population of young people, and particularly under age 10, from 10 to 19, and even less than 10. Focus has to be on getting resources to that group of individuals we've missed. Next slide, please. Now, this is a geo-coded map of COVID cases in St. Louis, stratified by zip codes. And many of you will not find this to be a surprise. When you look at where we're seeing the largest number of cases in St. Louis City, they've been in the same at-risk zip codes that we've identified for years as being zip codes that have the highest rates of chronic diseases, the highest rates of mental health and behavioral health issues, the highest rates of gun violence. And those zip codes are here. The darker the map, the greater the number of cases per 100,000 residents. And you can see a couple of zip codes pretty much light up like a Christmas tree. 63113 and 63147 have the highest cases, followed by 63115, 63107, and 63103. Now, this is really important for those who do epidemiology and public health, because COVID cases are affecting the region clearly, but we've obviously seen a disproportionate number of cases in the African-American population. We've seen a higher rate of deaths among the African-American population. In the city of St. Louis, 60 to 65% of all the deaths have been in an African-American community. That number is about 30 to 40% in the county. So that means that when we see this happen, that it's important for us to go in and do appropriate surveillance of those high-risk zip codes to make sure that we are protecting the members of those high-risk zip codes with all the PPE that you just heard about, that we're not, getting to on the ground. And we have to, where appropriate, identify individuals for quarantine and isolation. That's how we protect the community. And as I said before, the focus has to be particularly on vulnerable population and childbearing women and young adults. I think we need to add more to that higher risk group. I shouldn't say high risk group, but a risk group that has not received particular attention. They're not a high risk group, but they have not received particular attention. Next slide. Now, I shared this before. This was part of a study I was involved in back in 2008, looking at healthcare access in North St. Louis. And I want you to look at that prior graph that I showed and this one. And this graph is actually looking at certain healthcare indicators in North St. Louis. And you can see that the high-risk zip codes are pretty much transposable. They're the same zip codes that are high risk: 63113, 106, 107, and 115. Back in 2008, we identified those zip codes as having the highest rates of maternal child risk. It is high rates of infant mortality, high rates of preterm births, and high rates of maternal complications, high rates of low birth weight, as well as high rates of sexually transmitted infections and other healthcare indicators. This is not a surprise, because these are the districts that have been under-resourced for years, if not decades. And it should be no surprise that these are the risks that have these are the zip codes that have the greatest negative indicators with regards to COVID complications. My next slide, please. So as we think about opening up St. Louis, opening up the economy with this data in mind, what are the steps that we should follow? Well, I just put this slide together last night because I just received a report from the Centers for Disease Control on opening up the economy. As you may be aware, they completed a 69-page report which was submitted to the White House 2 weeks ago, and was basically shelved. And only in the past 24 hours have they been able to release this report, I think internally, and that's great, even though this mirrors what was initially reported by the White House. And so here are the guidelines: a 14-day downward trend in COVID cases. The Centers for Disease Control will say that if you've seen a 7-day trend, across the board, then that can be acceptable. You want to see widespread syndromic and surveillance testing. Syndromic means patients with symptoms. We want to make sure that anyone who has symptoms has unfettered access to testing. And then you want to do surveillance testing. We want to go in and test parts of the community just to get a sense of which communities are at risk. We want to do effective contact tracing. And you've heard a lot about this in the city and the county and getting resources to do this contact tracing. We want to be able to have quarantine and isolation. We want to have areas where we can quarantine people safely while providing them the proper services. This is a big issue here. We want to be able to quickly and independently supply sufficient personal protective equipment, PPEs, to this population, and they still engage in social distancing. And that, of course, is part of our goal to protect the health and safety of workers in critical industries, the people who have to drive the buses and who have to prepare food for us. These are people who have to be protected. This is what we're doing. What we need. We're going to talk about more, but these are the guidelines, and it's important that we hold ourselves and our officials accountable for following these guidelines. I think we've had some good discussion from a public health standpoint over the past week. I think that we're beginning to address these issues. I think we're beginning to work regionally to share resources. And I think we're in a better position now than we were last week ago because, again, of this shared sense of community as we protect ourselves and the vulnerable members of our community. Thank you. That was the last slide.
Great. Thank you so much, Dr. Ross. I've seen some of this data, looked at the slides or the charts on the health department website, but it really is so much more, it's very helpful to hear it interpreted and presented and explained by you to see the analysis that goes behind these slides. So thank you so much for offering that and framing the guidelines for opening the economy. We will move now to Rebecca Bennett, and following that, we'll move into the questions and discussion. So good morning, Rebecca.
Good morning, Kendra. Good morning, all. Thank you so much for this opportunity. So I am with you wearing two hats, right? One of my hats is as one of the principal leaders for Prepare STL. The other hat is as one of the principal leaders for the regional response team. So it's so good that you kicked off with Ms. Kaya, right, who is one of our canvassers. And so in both of those contexts, my job is to make sure that those who are disproportionately impacted by this virus and who are disproportionately impacted by the economic shutdown, right, have the information they need to be able to make the best choices possible to help ensure their lives to the best extent possible and to be able to recover from the social and economic impacts of our public health mitigation efforts. So in short, survive the shutdown, right? That is our work, to help people stop the spread of the virus and survive the shutdown. In my Prepare STL capacity and my regional response team capacity, I'm specifically focused on those who we identify as most vulnerable. There are a number of groups that might fall within this category, but my specific area of focus is on African Americans, immigrants, foreign-born, and low and moderate income individuals, right, within these groups. The reason for that is obvious from the data that Dr. Ross shared, right? So when we start to look at where we see concentrations of poverty, when we start to see where we see concentrations of people of color in terms of our geographic dispersion, and when we start to see where we see concentrations of impact from a virus standpoint, those zip codes are the same, right? Which means that we need a racial equity lens as we address this virus and its impacts. So Prepare STL, to talk about my role for a moment, is a joint campaign of the city and the county and community-based organizations, including Alive and Well Communities and the Integrated Health Network and the Regional Health Commission and the St. Louis Mental Health Board and the Coalition of Community Health Workers, right? We are all together figuring out how we can help folks get the information and access to resources that they will need to be able to survive during this period. A key part of what we have done is street canvassing. And you heard Ms. Kaya talk about some of the observations that she made from street canvassing. So we know that in order to help people get information, we have to do indirect things. We have to do media and websites and all those things, which we have done. So whether or not it's the American or the Post-Dispatch or radio takeovers or 95.5 or 104.1 or all that stuff we've done. But we also know that people really engage behavior change when they're in relationship. That means we have to be publicly present. We have to be visible and accessible. That's a hard thing to do when you have a public health crisis that we have. So you have to think about how is it that you can help people get the information that they need and the resources that they need in the midst of a crisis that says that what we really should do is distance ourselves. And the best way we figured to do that is to develop street teams that send out information. They, of course, are wearing protection. They are only doing a small number of areas and of locations, and that's within the footprint that they live already. And we are doing it that way. And so in that way, we identified 20 zip codes that we call target zip codes based upon the kind of data that you saw Dr. Ross share. And within those zip codes, we decided, which are primarily North City, North County, and portions of South St. Louis City, that have the highest incidence of poverty, highest concentrations of people of color and African Americans, and also the highest incidences now of COVID-related infections. And in those communities, we hit every grocery store, gas station, convenience store, laundromat, school, pharmacy, liquor store, beauty supply, health center, check cashing store, and early childhood education center. We're in fact doing an early childhood education center canvas today and tomorrow, 221 of those centers. And in those spaces, we've managed to connect with more than 550 community hotspots where we share information about what this virus looks like, how people can protect themselves, where they can get critical resources, food, childcare, behavioral health and mental health supports, those sorts of things. We share that information on laminated posters that these sites allow us to put up, or via yard signs or other kinds of collateral material that we have. We also take into consideration what we're noticing when we go out and about. So at the end of this week, we will have hit more than 800 hotspots. And we've got all of our information in multiple languages with different providers identified based upon which community we're talking about. So we don't assume that the providers are interchangeable. Right, so we have done some observation. Ms. Kaya shared with you some of the observations, but the very first thing we noticed is that our people didn't have protection. Now we are talking about reopening, and we are not just talking about reopening in the context of what it is that you need to do to minimize your exposure to the virus. We're also talking about reopening in the context of restrictions, service restrictions. That is to say, if you want to get on Bi-State, you have to have face masks. If you need to get service within St. Louis County and other kinds of places, part of the city, if you want to get service, business owners or service providers can deny service based upon whether or not you have adequate protection. This is a consequence of reopening. Like, if we want to reopen safely, we want people to be protected. And we want to help stop the spread of this virus as much as possible. And so now we are seeing service restrictions that say you must have protection. The challenge with that is not that it doesn't make sense from a health standpoint. It makes absolute sense from a health standpoint that you would want to be protected. We want our bus drivers to be protected. We want all of our service providers to be protected. We want our business workers to be protected. But you've got to juxtapose that with the reality that many of those who are disproportionately impacted do not have access to that protection, nor can they afford it. So if you're on this call and you don't have face masks, chances are if you try to go onto Amazon and order them, it will take you 4 to 6 weeks to get it, even if you had the money for it, because of supply chain issues. Now, if you don't do Amazon, but you're gonna try to get a mask through the gas station, chances are we've seen prices range from $2 to $12 per disposable mask. And if this is something that you need every day to minimize your exposure, which Dr. Ross and others would suggest that we do in order to flatten that curve, we're going to need protection, some measure of protection if we're out and about in the public every day, then you can see how this would add up and create some real challenge for our community members who are most vulnerable and who have the least ability to be able to get the protection that they need, both access it and afford it. So this is a reopening reality. And it means then that not only will they be struggling with the virus itself, it means that they will also be struggling with the ability to be able to access any basic services, the ability to get to work if they rely on public transit or get home, the ability to go into a store or other kind of setting and get what they need. Now everything becomes more complicated. It becomes more challenging and difficult on top of the situation that is already difficult. So I want to sort of sound the clarion alarm around that. And part of our responsibility is to really make sure, to the best extent possible, that those who are disproportionately impacted and most vulnerable, both by this virus and our shutdown, have the means to be able to enter into reopening with everybody else safely and are not further disadvantaged by our restrictions. That is the work that is before us in the next weeks and the next month, is to make sure that these realities are true. In my regional response team hat, again, we are concerned with bringing coordinated response around the critical needs, again, of our vulnerable populations. In this way, it's beyond St. Louis City and County. Our footprint also includes Madison County, St. Charles County, and St. Clair County. We want to make sure that there are effective solutions and approaches to supporting providers who are doing basic needs work, right? And delivering critical services, which all of our providers who are in taking care of our moms and our babies fall within that category. We want to make sure that we deploy critical resources in strategic and efficient and effective coordinated manners. And we want to highlight the needs and opportunities for our community with funders and others who are in the position of influence and who have the means to help make a difference. So that gives you a sort of overview of our role and hat. In both of those capacities, part of my work is around not just information, but virus protection. And in this case, it looks specifically at PPE for African Americans and foreign-born immigrants and low and moderate income individuals within those areas. And so we've been doing massive PPE distribution, specifically masks and some sanitizers, but much more soaps and gloves and other kinds of things directly to individuals, not just to institutions. Institutions matter. But when you saw Dr. Ross's graphs and he's looking at numbers of new cases, that's of regular people like you and me. So how do we make sure that both our service providers who are delivering the resources needed for life and our everyday folks have the kind of protection that are going to help them weather this particular storm? And that is a part of what our work is focusing on. How do we get critical protections and supports to those who are at high risk but have very low access? And that's with regard to both organizations and individuals. So that is the bigger frame that really motivates me and keeps me up every day and at night. How do I think reopening is going to impact our community? You heard me say that I think that those of us who are already vulnerable are going to be further disadvantaged. I'm very, very worried about that. And so it is incumbent upon our leadership to make sure that this does not actually bear itself out, right? And that's an alarm that we all need to be crying to make sure that that really does happen. The supports and the messaging that are most needed for all of us who provide service and who are operating in this space. It is incumbent upon us as we prepare to reopen to sing on the same song sheet about this one critical message. There is no returning to normal. There is no returning to normal. That is not happening. It doesn't happen because on 5/18, our city and our county reopened. In fact, Dr. Ross made the case for why this is not, our reopening is not based upon sound epidemiology. We are reopening because we live in a poor state. So I'm just gonna be front, or you get my, what's the word I'm looking for? I'm gonna be blunt. I'm mixing frank and blunt, and I got brunt. Work with me, right? I'm just gonna be frank, right? We live in a poor state, and our poor state depends, its economy largely depends upon sales taxes. It's oriented around sales taxes more than income taxes. So when we are shut down from an economic standpoint, it has an adverse consequence on our state, and it has an adverse consequence on many of us. I get how difficult these economic times are, but I also understand that the medicine and the science don't yet support the kind of reopening that we're engaging in. And therefore it is bringing with it risk, right? And these are difficult choices to make, right? Do we support the sanctity of life, and how much of that is influenced by quality of life considerations, right? And our leaders right now are trying to figure that out. But as they are figuring that out, what we need to be clear about is that there is no returning to normal. Whatever life was like in December of 2019 or January of 2020 is not what it's like on May 20th. And it will not be like that on June 20th, July 20th, October 20th, December 20th, or January 2021. So the best thing that we can do to help keep our people alive, whoever fits within your bucket of our people, is to be clear that if you want to live and you want to see your families live well you want to have the best shot of being able to survive, you're going to need to get personal protection. You're going to need to use it daily, right? Depending upon your level of interaction. You should assume that you are contagious. We will make the healthiest decisions if we make that assumption. Assume that you are contagious, because that's not just about protecting yourself and your family, it's also about how do we protect our community. So let us do the kinds of things that help keep us as safe as we possibly can and keep our neighbors and loved ones as safe as we possibly can, right? Because we've reopened doesn't mean that we should no longer socially distance. It doesn't mean that we shouldn't stay at home as much as possible. It doesn't mean that we shouldn't wear masks, whether they're cloth masks or higher protection surgical masks or KN95s or N95s, depending upon duration of contact with people and how many people we are connecting with. So these are going to need to be the kinds of things that we help our folks understand. And we're going to have to help them understand within the context of distrust. This is the last thing that I will say. Because there is a great degree of distrust of our public institutions. That was true before this virus. But it is certainly also true during this virus. And so part of what Kaya has talked about is, right, people are like, oh, no, that's not real. Right, they don't necessarily believe it when they're hearing it from the media because of the difficult relationships with the media that many of us have. They don't necessarily believe it when they hear it from government because of the difficult relationships with government that we often have. They don't necessarily believe it when they're hearing it from our healthcare establishments because of the difficult relationships that we often have with our healthcare establishments. Right, which means then that those of you in positions of influence where you already have relationships with clients, community members, where you were trusted, right, they might believe it from you. So we need you, to the best extent possible, to be sharing the truth as you understand it about this disease, using information like the kind that Dr. Ross shared, using insight like the kind that Kaya shared, but singing on that song sheet that people, please do not relax your vigilance, because that's how we keep getting these spikes, and it could very well mean you and those you love. I think I've answered all the questions.
Thank you, Rebecca. That was so important, a call to action to activate us as all part of the solution to helping protect our community. And the reality of the duration of this pandemic and the ways we need to practice social distancing and protect ourselves for months has an impact on how do we make sure these resources are available long-term in our community. This isn't a one-time distribution, right? This is an ongoing months and months of ensuring that we're in the community, making these resources available. Thank you so much, all of you. I want to circle back to Kaya to see if you had any reflections or additional comments before we open it up for questions. You're muted, Kaya.
I had a question for Dr. Ross. He said that there is a second wave coming. My concern is we're not really prepared for this first wave. Do we have any things in place that's going to help our neediest families and pregnant moms to even prepare for the second wave? Knowing what we've heard from Miss Rebecca as far as masks being from $2 to $10 just for one, and stores turning away moms who have their children with them because they're not masked up, but you probably can only afford one mask. How will we even sustain in a second wave if we're not really prepared for the wave we're already in?
Well, Kaya, that's a real sentiment. And no, the candid answer is that, I think Rebecca just stated, the obvious, that we have to, she used the term vigilance. We just have to be more vigilant. Sure, we've had a supply chain problem with PPE, personal protective equipment, but I think that's gonna lessen in the weeks coming forward as money is finally trickling into communities, although they may be disproportionately trickling into St. Louis City compared to others. We're going to see some easing of that supply chain, and we're going to see more PPE arrive in St. Louis within 3 to 4 weeks. That's good. What we've been pushing with Prepare STL is to really get that, get the PPE in to these essential workers as quickly as possible, and that's why we've had this broad appeal. We do think that we're going to actually have more equipment, and I'm confident that we're going to see more equipment coming in. So that's not the real issue, however, that concerns me. Even if we have access to this, my concern is that there's going to be this false sense of security, that we've weathered the storm. The economy is open. That means that we're ready to go and do those things that we do. Let's go to the bars. Let's go to the do the sports. Let's go swim and all those things. Particularly as it's getting warmer. That is my concern. And as we have that type of community, socialization, we will have spread, we will have propagation because the virus is still among us, right? So the key is this is the hardest part for us, as a people, as a country. We are very social. The hardest part is going to say, you know what? We still have to be vigilant. We still have to keep our distance. That's a really simple answer. We always say, Dr. Anthony Fauci always tells us that the virus will let us know what it's going to do next. He is correct. The virus is pretty much in charge. However, we have some. We have the ability. We have the ability to respond also, and I think that our responses should be, we're not going to capitulate to this virus. We're going to protect and defend ourselves. We're going to maintain proper distance. We're going to wear these masks. We're going to wear these masks in June and July and August and September. We're going to put these masks on our kids. That's what we have to do. We have to get used to doing that. That's a behavioral change. But that's how we're going to get through this. That second wave is coming, no doubt. Is it going to be a large wave that will overwhelm us? I hope not. Will it be a small wave that we can get through? I hope so. But that's going to depend on our collective response.
Thank you, Dr. Ross.
Thank you, Dr. Ross.
Had a number of questions coming in. I see Dr. Ross has answered a couple in the Q&A box. I want to just make sure to say, orally, mention this, the answer. The first question, why did the governor send less money per person to the city? More money was sent to the county per person. And part of Dr. Ross's answer is that the CARES Act directed money initially to large municipalities greater than 500,000 people, which does not include St. Louis City. Because we're separate, the city and the county. The bulk of funding, around 170 million, went to St. Louis County, while the city will receive 35 million. So that is the answer to that question. It's a question about when daycare or temporary daycare will be open to the general public. Dr. Ross suggests that you check with the health department directly about that, but this is a point in the webinar that if someone on the call has information, you can add it into the chat box and share what your resources or your answers to that question can go into the chat box to share with
Kendra,
others.
I can also give some information. Right now, today
Great.
and tomorrow, we're doing a canvas for our early childhood education providers specifically, and 221 of them. So we got the list of who's open and who's preparing to open. And for each one of those sites, we printed out, we've got someone going to the site, giving information, the posters that we were saying, putting up yard signs about how to stay safe, right? We also printed the state's guidelines on reopening for early childhood education centers. That's a 30-page, what we call a 30-page Bible. We printed that for each one of those daycares that was open so that they could have it. And we have given them 28,000 surgical masks. 22,000 surgical masks and close to 7,000 KN95s that provide higher levels of protection, and turn those into kits that they can use to help extend their ability to work safely as much as possible. So that distribution right now is happening both to childcare centers that are currently open and those that intend to open probably within the next week or so. There will be even more that open after that. And so we have to keep figuring out what's the level of resource that can support that and who else will be helping with that. But they were on our priority list as an essential community hotspot, right? So education for their families and protection for their staffs, because our early child care providers, we know that in the early stages of this, a couple of them died, in fact. So we have to be very, very careful there.
Wonderful, thank you so much. Will that be an individual decision whether child care centers decide to open if they can follow the 30-page guidelines?
Right, there's a whole effort right now among the early childhood education hubs. They've also approached the county executive about what it takes, and groups like United for Children and We Power are working with them to really support them in being able to reopen safely and get the kind of funding that they will need to be able to have the sort of strictest kind of adherence to guidelines to be as safe as possible, and get the support. So the need for support there, financial support, PPE support, and others is critical, along with the guidance. That is also critical.
Thank you. There's a question about where we can get the best one-pager fact sheet that Kaya stated we need to share with our clients that do trust us. Where's the best source of information or fact sheet available?
We have that on the Prepare STL website. So she's referring to the flyer that we pass out. So there is that flyer, it's double-sided, and it has great information about how to know what the disease looks like, how to detect it, if you feel sick, what you should do, how do you keep, what can you do to stop the spread? If you're feeling blue, what kinds of things will help you, right? It's got, if you need food support or other kinds of things, where to call. So it's got that. So if you go to www.preparestl.com, the flyer is on the website. That website also translates into 6 different languages. It's on the homepage. So if you have clients that speak other languages or from other cultures and communities, they can also access that. And all of those materials as well, flyers, posters, PPE, instruction guides, all those things are also in multiple languages. So
there's great videos on the website too.
There are tons of videos on the website. So videos from everyday folks, including and from experts like Dr. Fauci, right? to people like me, to everyday people who are like, this is how you do a mask. This is how you make your own mask. This is how, like, you know, we've got all of that there.
That's great. And you've mentioned in the chat to stop by the T. That's where some of the materials are collected and for Prepare STL. Is that correct,
Yeah,
for PPE?
I meant to send that to, no, not for PPE directly.
Okay.
I meant that for Kaya. She wants a yard sign.
Oh, okay. Sorry, can't do multiple things at once. And
She wants a yard sign. So I said, oh, go ahead. You've already been there. Stop by the T. No, please don't stop by the T unless it's an appointment for you.
all right, thank you for that clarification. This question is for you, Ms. Rebecca. What can we do to help you educate community about the lack of access and PPE to the disadvantaged? How can we help your mission moving forward?
Oh, I think this is wonderful. Again, sing the gospel song called "There Is No Return to Normal." I think that's a very, very important thing. Do not relax vigilance. I think that everywhere we possibly can, we need to be asking from all of our decision makers, what are the plans to ensure that those who have the least amount of means also get the greatest protections, right? Because if the fact that they have the least amount of means that they are also the most vulnerable. So how can we make sure that there's adequate PPE support? What are the supports that are being given to those who need it the most? I think if we keep asking those questions, part of what happens is it moves it to top of mind. We should be asking our elected officials what they're doing. We should be asking our civic leaders what they're doing. We should be asking our healthcare leaders, what are the provisions that you have for those people who have the least amount of access and have the least ability to afford, right? That is something that we can all ask. And then I think, you know, what is your agency or your ability to be able to provide support or access in any way? Specifically, I think the ask that I would have of this community and those who are on this call, our intent is to purchase a couple 100,000 cloth masks for distribution within the next 6 weeks. So probably won't be available before the end of June, early July. So we've got a sort of two-part strategy. In the immediate term, it's to get disposable masks out there and to help extend the life of that as much as possible. In the longer term, really, we all need to be pivoting to long-term protection, which really looks like, from a PPE standpoint and just the mask standpoint, most of us will not need KN95 or N95 because our level of risk and exposure doesn't necessarily warrant that. But cloth masks will probably be what people have the greatest, gives them the greatest control. We don't have to rely on the supply chain for that in the same way, and they can just use it properly. Right? I see a lot of people with masks, but the masks are hanging around their chin. It's not doing them any good in that way. Right? So we intend to distribute at least a couple 100,000 cloth masks earlier in the summer. And we would love to coordinate with our maternal and infant mortality community members and vitality, let me say that, my maternal and infant vitality community members, to figure out how we can be smart and strategic for getting those masks. And we'll do two types of masks on that, adult mask and child mask. So they're not going to be infant masks though. So we don't have that, but adult mask and child mask. So we're going to want to work with this community to be able to get a good deal of that out to the people that you serve and to your team members.
Thank you so much. There's a question, and I think the answer might be the Prepare STL website, but I'll just put this out there and sure if there's any other resources. It's a question of, are there any info sessions outside of Zoom that community members can be educated on reducing risks and knowing accurate data?
Dr. Ross Akaya might have some information on this. One of the places we partnered with Dr. Lori Punch at the T, and Dr. Punch's YouTube page, and it's got lots and lots of videos on how to be safe with PPE, proper utilization, what to know, how does the virus work and operate in ways that people can understand, right? We've cited a number of their videos on Prepare STL, but there's a longer list, and they've got TikToks and other kinds of things that make it interesting. They've got some in Spanish, right, and English. So I'd encourage that is a source. There are many sources, but that is a source and one that we use and rely upon.
Great, thank you. Question about information about local plans for effectively deploying contact tracers. So does anyone on the panel know information about local plans for effectively deploying contact tracers? And what specific tools and tech will be in place to support them?
Sure. Let me answer that. There's been a lot of media interest and attention on contact tracing over the past 48 hours. As I mentioned before, contact tracing is a major element of successful reintegration of people into the economy. That means that when someone is positive, we will send someone or have someone call and identify the people who've been in that social circle, so we can do the appropriate quarantining and isolation as necessary in order to prevent those people from spreading the virus even further. There are a number of ways of doing that. Our old-fashioned way in public health is to actually send people out into the community, knocking on doors and things, like that. That's not always practical in this current situation. So we need to do things remotely for the most part. You still need people. You need full and able-bodied people to do that. The St. Louis County actually has, as I mentioned before, they have a significant amount of more funding to do this. So they've hired, or they're in the process of hiring up to, within the next 3 to 4 weeks, I think their intent is to have up to 70 to 90 individuals who can do contact tracing. They're phasing that in, of course. They don't have those people now, but they're gonna phase that in. And so the city is more financially challenged. But what has been done so far is to use the staff in the city health department, to use automated mechanisms of contacting people, to use volunteers, particularly medical students. We realize that now, as we see this expand, that's not sufficient. And so there's now resources to hire additional people to go and do more expansive contact tracing in the city. And that also will be ramped up over time. The Centers for Disease Control has a website looking using a rubric. This is also coming from University of Washington, of how many people you actually need to do contact tracing per 100,000 people. And based on those general guidelines, we need up to 90 individuals. I think if we've created a way of having staff and web and automated services and volunteers do a part of that, then we certainly won't need that number of people. If I'm estimating that we certainly could benefit from having another 20 to 30 individuals brought into the city to assist us, at least based on the current number of cases that we have. And as of this week, that process is starting. And so we are responding appropriately to the need for contact tracing.
Thank you, Dr. Ross. There's a follow-up to the question about where are there other community sessions or information sessions. Ms. Deal pointed out that for community members that lack internet access or have literacy challenges, where are the sources or ways in which we can disseminate and share information and connect them to information about reducing the risks?
Well, I think the most, again, I think that Ms. Bennett and her role with Prepare STL really is the phenomenal contact on the ground. She also alluded to the regional response team that is working so closely with us. That's a team that was constructed by Brown School professor, Washington University Brown School professor, Dr. Jason Purnell. And so they have also working mostly within the social services sector in St. Louis, getting a phenomenally effective campaign out about information about COVID, how to integrate our social services, how to create more of a seamless network. And so between Prepare STL and the regional response team, as well as information that we gain from the city and the county health department websites. Certainly, as you go into other websites across, United Way, for instance, phenomenal organization, has done a great job of getting information out there. And so I think that those areas are going to provide the lion's share of really good information that's written at the right literacy level, embedded with videos and all sorts of ways of really getting the information out there. I think those are the venues that are doing an excellent job getting the information out there.
Yeah, I want to add that our website is mobile friendly for those who access from a mobile standpoint, but we also have decidedly low-tech means of getting information out. So those posters and things that are at all of those locations that people go to, but then we use a lot of infographics. So I don't know if I have the ability to share screen. I will here. Can you see that?
Yes.
Right, we have these yard signs. So if there are any of you who would like these yard signs, we have these yard signs, right, that have infographics. They're not text heavy. And if you'd like them, you can let us know. They're big, so they're bigger than the typical yard sign. They are maybe 24 by 36. And so we have found low-tech ways of being able to also communicate what can people do to help stay safe, right, as safe as possible. And so I think Kendra and others can share my contact information if there are those of you who want those as a way, as a decidedly low-tech, does not require internet access, right, or cellular service to be able to see. If you're willing and would like that, you can. I also want to say from a PPE access, one of the things that the regional response team that we're doing is we really are focused on coordination in the personal protective equipment space. And so we've been asking agencies that are providing essential services to fill out our risk assessment survey. And so if there are those who are on this call that are interested in doing that, it helps us take a look at what the needs are for PPE, not only by individual organization, but by organization type, right? So what are we seeing is needed with regard to those who are serving the unhoused, or what are we seeing is needed with regard to those who are serving moms and babies, or what are we seeing that's needed with regard to those who are providing direct food support or basic needs assistance, right? And that allows us then to be able to make some good asks of our community leaders in terms of resourcing those areas. And it also gives us a sense of what the individual organizational needs are, so that if and when we get allocations of PPE, we are able to disseminate them. And we're expecting maybe 100,000 surgical masks within the next week from St. Louis County. So if we have agencies that serve moms and babies who are on this call, would love for you all, if interested, to participate in that survey. It went live maybe 8 days ago. And in that time, we've had 343 organizations respond. Again, our focus is on those who are experience sort of high risk, and we define risk as sort of risk. Clients are experiencing high risk, staff members also have heightened risk, and geographic risk, right? So we know where infection is concentrated. And then access, and we define access really both in terms of pipeline and supply. Like how much do you think you're gonna have? What's your runway? Are you gonna run out soon? Are you rationing supplies, kind of thing? So if there are those of you who are interested in that, we invite you to, and I'll put the link to the survey in the chat. You're welcome to do that. And if and when we get the kinds of supplies we're able to provide, we will do that. And to the extent that we are championing industry sectors groups, we will certainly also take this data and share it.
Thank you. We'll make sure to share that link out when we send the follow-up to this webinar and to all of our constituents too. We'll get that out. Thank you so much. It's really part of our these great connections and relationships that exist in our community, where we can share this information and it can move into the way decisions are being made of distributing resources. So Rebecca, thank you for connecting all of these dots. There's a data question for you, Dr. Ross. Is there a relationship between the decline of hospital admissions for COVID-19 and the number of deaths where those who died should have gone to the hospital but didn't want to? So the lack of information and awareness of the seriousness of this pandemic might have influenced their decision to stay at home and not seek necessary treatment from the hospital. So are there less admissions and more deaths?
That's a good question. That's a really thoughtful question because what they're asking is, do we have cases out there that are unidentified and that COVID has taken the full wrath, resulting in those individuals losing their lives, and as a consequence, they simply didn't get included in the caseload, the data that we use to create those graphs. That's a possibility. I don't think that's the main issue, but I certainly put that out there as a remote possibility. We clearly think that the main reason we're seeing a reduction in COVID ICU cases is because as a region, for the most part, we've done what we were told to do. I shouldn't say told, we were asked, we did what was necessary. We came together, for the most part, we abided by the shelter in place guidelines. We stayed at home, we masked, we kept the social distance. We actually did it, okay? We, as a community, as a group, as a people, we actually did what was necessary. And as a consequence, we were able to stem the tide of this. I think that's the main reason we're seeing a reduction in those ICU cases. But we clearly know that there may be people out there who contracted this disease who were not identified. We're not doing, well, to my knowledge, as of last week, 2 weeks ago, we're not automatically doing COVID testing on all cases, deaths in St. Louis. That was 2 weeks ago, that data may have changed. So 2 weeks ago, I know that we were not doing COVID testing on all deaths. And so some people could have been missed, but I think that was a small number of people. Most municipalities, and St. Louis, I hope will join us, are trying to correct for that by simply looking at not just all directly linked COVID deaths, but deaths that were likely COVID deaths, or deaths that were provisional COVID deaths. So that someone has a nurse, someone has a fever and a severe cough and shortness of breath, and then they let their family and friends know, but they die at home. That should be counted as a COVID death. And I think that we're not, our data systems and collection systems and case identification isn't as widely aligned among jurisdictions, so that we're not really using that full case definition. And that's why I think that's a good question. We should know that there are likely deaths out there, and they should be considered part of all COVID deaths, if that makes sense.
Yes, thank you. We're already at 11:15. I can't believe how fast this time flew by this morning, and I know there's probably more we could share and talk about and more questions to answer, but we're going to have to bring it to a close this morning. I want to thank Ms. Kaya Shelton, Dr. Ross, and Ms. Rebecca Bennett for taking the time to share information with us today and be part of this discussion with the maternal and infant health community. And thank you to the Generate Health team who have put this together and make this webinar every week a success and quality information and connection. And thank you to everybody who's been joining in and participating week after week, and for all that you are doing to care for moms and babies. And I think the takeaway message today is that we all have a role and responsibility to convey and share consistent information about we're not returning to normal, right? That we're not returning to normal, and how we must remain vigilant in our efforts to protect ourselves and those around us. Following our call today, you'll get a link to this webinar. We'll share out the information and resources that have been shared. We also send a survey, so love to have some feedback. And one announcement, that is we are partnering with Vision for Children at Risk and St. Louis Child Abuse and Neglect Network to host a virtual legislative wrap-up on June 5th to discuss how the legislative session in Missouri will impact kids. So join us. You'll see more information come out about registering for that legislative wrap-up June 5th at 9 a.m. And next week, same time, same place, we will host the next Navigating COVID-19 for Moms and Babies webinar. With that, again, thank you to our panelists and thank you to all attendees, and have a wonderful day.
Thank you.
Bye-bye. Thank you.